Hello, everyone, and thank you so much for joining us this evening. My name is Anastasia Spramuli, and I'm the Director of Graduate Admissions here at Bay Path University.
Hello, everyone. I just turned my mic on. My name is Latasha Allen, and I am the OTD graduate assistant and a second year student on the mental health track. And so I would like to take the time to introduce our two presenters for tonight. I want to start off with Miss Hayley. So our topic are Miss Hayley and Miss Jessica. So thank you all for coming tonight, and we're really excited about your presentation. And so our hot topic tonight is the role of occupational therapy in maternal health. And our guest speakers are Dr. Hayley, I don't want to mess this up, Chrastowski. Oh, Chrastowski. Okay. And Dr. Jessica Peterson, two of the co-founders of Maternal Health OT. Maternal Health OT is a collaborative space for like-minded OT practitioners in maternal health and infant development to come together and support each other in their respective businesses and practices. It sounds really interesting, ladies. A little bit about our presenters. Dr. Hayley Chrastowski. That good? Great.
Yeah.
Has over 8 years of OT experience nationally and internationally in outpatient pediatric inpatient acute care and neonatal ICU settings. Hayley created her private practice, Wild OT, after witnessing the unaddressed needs of maternal and infant populations within our traditional healthcare system. Dr. Jessica Peterson is the co-owner of Matrescent. Can you say that for me, Dr. Peterson?
Matrescent. You got it.
Occupational therapy, a mobile private practice specializing in maternal and perinatal health and wellness in Austin, Texas. Dr. Peterson is also a mom of two, a certified lactation counselor, a perinatal mental health professional, and an infant massage educator. And she is currently pursuing her international board certified lactation consultant certification. I would like to say before I introduce you all, this is outstanding, ladies. I just have to give my little bit of tidbit just to praise you all. I love the fact that OTs, we can be everywhere in the world and we can be in every setting. So I'm really excited to hear the presentation. And without further ado, please join me in welcoming our presenters, Hayley and Jessica. Welcome, ladies.
Hayley, do you want to take this first slide?
Yeah. Thank you guys so much for inviting us to be here. We're really excited to be a part of this and have been invited into this space and to share with you our work, but also how our work is connected to maternal health and what that looks like in many different spaces and avenues and how you can take this in a lot of different directions. So tonight we're going to be presenting on the role of occupational therapy in maternal health. Just a little bit about myself. So I am the owner of Wild OT, which is located in Fredericksburg, Virginia. My office is nestled inside of a freestanding midwifery and birth center. So I get to work really closely with midwives day in and day out as I run my practice. And they have been huge mentors in the work that I do. And I work with women and infants. So from preconception all the way until 3 years of an infant's life is kind of the space that I work in.
And I am Jessica Peterson. I live in Austin, Texas, and I have been an occupational therapist for 13 years. And around 2022, which is, I guess, 2 years ago now, I transitioned from working in more traditional healthcare settings to really specializing in maternal health, infant feeding, and lactation. And I co-own Matrescent OT, which is a private practice specializing in infant and maternal health, providing home-based therapy and support families within a pediatric office. And I also recently started Milk Stories, which is a community-based model focused on the intersection between maternal mental health and breastfeeding. And as mentioned before, I'm a mom of 2 little girls who are now 6 and 9, an aerial circus arts hobbyist, and a foodie. All right, so today we will share a little bit about the role occupational therapy plays in supporting maternal health and why this type of support is important. And we'll explore some of the occupations of mothers and babies and look at a few practice areas where this work may be taking place. So let's begin by taking a look at maternal health through the lens of an occupational therapist. So I know this is a multidisciplinary audience. So while some of you may be very familiar with occupational therapy, many of you may also want a refresher. So occupational therapy is a healthcare profession that supports people across the lifespan and uses daily activities, or what we call occupations, in a therapeutic and meaningful way to increase health outcomes and well-being. We address many aspects of physical and mental health to improve function and independence according to our clients' individual goals. We use an evidence-based practice to promote development of skills and also adaptive strategies for clients from infanthood all the way through geriatrics. And this looks very different depending on which setting and which client populations we're working with. So you may be familiar with occupational therapy in one setting and very confused about it in another. That's par for the course. So maternal health occupational therapy is an emerging practice area that supports and promotes a holistic view of both physical and mental health of mothers, parents, and parent-child dyads. And in this area, most occupational therapy providers do focus on the perinatal periods, which include pregnancy and postpartum. But maternal health occupational therapy can be applied to preconception, including support for parents who are undergoing artificial reproductive technology treatments and other phases of motherhood. As we know, this is really a lifelong developmental stage. As occupational therapists, we treat and consider both the parent and the child in a holistic and ecological approach. And by definition, being a mother includes an identity and also occupations that are shared with the child. Maternal health occupational therapy is an active collaboration towards treatment and is always client-led. So it's important to know why maternal health is an appropriate practice area for occupational therapy. There are many things that are mentioned in this slide that deserve presentations and deep dives of their very own. And I encourage you to learn more if you feel very passionate about these topics. There's a lot of amazing stuff out there and amazing things being done. But today I'm just going to touch base on a few that I find especially important. So first off, we know from many decades of multidisciplinary research that maternal health is a significant predictor of optimal infant development. In other words, by supporting the mother, we also are indirectly supporting the child. And the shared experiences and occupations, or what we as occupational therapists actually called co-occupations, between mothers and children affect the emotional, social, physiological growth and development of both parties. The rates of perinatal mood and anxiety disorders, including postpartum anxiety and depression, which are the ones that most people are more familiar with, have risen at an alarming rate, especially in the United States. In fact, as many as 1 in 5 women may experience a perinatal mood disorder that lasts beyond 2 weeks postpartum. And research shows that these conditions can be resolved through proper and comprehensive treatment and support. However, untreated, these mental health disorders can have disastrous and very tragic results, some of which you may have seen on the news lately. So occupational therapy providers uniquely address both the co-occupations and mental health, and our very holistic lens enables us to therapeutically treat this population through the act of doing. And if you think about it, motherhood is an ideal developmental phase for targeting healthcare interventions, just as any other time of life. All right, so let's go ahead and move on to the occupations of mothers and infants. Take it away, Hayley.
All right. Okay, so we are looking at prenatal occupations. So as the woman's body is changing throughout pregnancy, everything around her, the way she engages with the environment, is also changing, and at every single stage. So as she gets bigger, everything changes again and again and again throughout the entire pregnancy. So when we're looking at her occupations, we're looking at her ADLs. How is her functional mobility changing as she's moving throughout her environment and as her center of gravity is shifting forward? How is she engaging with her daily tasks differently? I mean, putting your shoes on, putting your socks on is different. Picking up a pen off the floor, those daily tasks get really hard. And then also looking at sexual activity. This is an area that I think, unfortunately, gets overlooked a lot, especially if we're looking at like the OB and midwives, even all of them together sometimes really forget that this is an ADL. Intimacy and sexual activity with your partner is an ADL. And we need to help women work through this time period to figure out how they can maintain that engagement. We're also going to look at her education and or her work. So what changes are happening as her body is changing to the way she's either sitting at her desk all day long and the ergonomics of that, the way she might be participating in her environment, carrying a backpack if she's going to class, just all the ways that her body changes in regards to pregnancy, and then how that changes her engagement with these activities. We're also going to look at health management. And this is like the newest portion of the AOTA practice framework. So health management can include symptom and condition management, nutrition management, physical activity. So this is like a really robust area of what we are able to do with women. So we can work with women on labor and delivery preparation, whether that's learning positions, learning how a partner can support you, learning, maybe some labor positions are hard to get in and out of. Well, what can we change? How can we work on that with you as an OT to make it easier to get in and out of those positions? We can do a lot of education on postpartum preparation, which is also, unfortunately, a very overlooked part of motherhood. We spend a lot of time focusing on pregnancy and birth and not as much time focusing on postpartum. And as OTs, we are great at addressing this time frame and the changes to the house, to your bathroom, to your body, to your bed, all of that. And then we can help you navigate some of those topics with your doctor and really figuring out what questions you need to ask, how you can feel more supported by them, and just really brainstorming this area that, especially if it's your first, feels really new and unknown. And then, as always, as OTs, we can look at rest and sleep and the ergonomics of sleeping and social participation, which we know is a huge component of our beings as humans. So then we have all these prenatal occupations, but then we also have all these postpartum occupations, and now everything has shifted. So no longer do you have this center of gravity, this mass in front of your body from the inside. You now have it on the outside. And now you're changing the way your body is moving. Not only that, but you have a weakened core from being pregnant that impacts the way you do everything. And then on top of that, you're bleeding, you're healing, you're recovering, whether it's from a vaginal delivery or a C-section, all of that impacts the way that you can interact in your everyday life. So again, we're going to look at those ADLs. We're going to look at your functional mobility. We're definitely going to look at toileting, because this is a time where getting on and off the toilet can feel really challenging, especially with a C-section delivery. Also, grooming and hygiene to the perineal area. We can work with that. We can help you set up your bathroom and your space to make all the items that you need when you're changing in the bathroom, like, you know, whether you're wearing like a Depends or pads, we can help you set that up in advance to make your bathroom time a little bit easier. And then we can teach on that sexual activity, returning to intercourse. What does that look like postpartum? What does that feel like? And what if there are issues? And again, you know, oftentimes in that 1 6-week postpartum visit that you get, sexual activity gets overlooked. And there's not a lot of time where you're provided the opportunity to ask questions. And unfortunately, sometimes if you're having any issues, they're diminished. So this is where OTs can really come in and make sure that this is being addressed. And then if we're looking at those IADLs, so we're looking at child rearing. Like child rearing is actually stated in the AOTA practice framework now, which is, you know, as a maternal health OT, we're finally like, yay, like these things are being looked at and included in our profession. So child rearing, home establishment and management, and whether that's, you know, taking care of other kids, or maybe you're in charge of meals and laundry and cleaning, but all of that's going to be really hard if you also have a baby and you're also sore and recovering. So how can we help with that? And then looking at that return to work, that education, and management of personal devices. And this one is huge for us as OTs, because we can help with women if they're breastfeeding or bottle feeding or pumping. There's a lot of equipment that can come with that. And we're able to help with, how do you set that up? How do you clean it? How do you manage it? So that this area doesn't feel so foreign and confusing. And then that health management section, again, same thing, just looking at symptom and condition management, helping with nutrition management, which is huge in the postpartum period. I mean, nutrition is important during pregnancy as well, but during postpartum, if you don't have proper nutrition, you're not going to heal as well, and you're also not going to produce as much breast milk because you might be calorie deficient. So then this is where we can help either navigate it ourselves or refer out to somebody else who can help navigate it a little bit better. Looking at physical activity, social and emotional health and well-being. And this is huge as OTs. I mean, the root of OT is in mental health. And as Jessica was saying earlier, 1 in 5 women are starting to suffer from issues that are lasting beyond 2 weeks postpartum. And this is something that as OTs, maybe we don't have the skill set to address or diagnose or manage it, but we can catch it and we can provide you with support and also provide you with references or resources of who you can reach out to make sure this is not getting overlooked and just swept under the rug. And then again, rest and sleep, that's going to change as you're postpartum and you're figuring out where your baby sleeps, where you sleep, how that looks, making sure you're getting sleep, especially if you're having any mental health issues, and then how to return to social participation. I think Jessica and her co-owner of her business, Gail, shared a story once about one of their appointments. They took a mom out into public because what she was really struggling with was how to figure out how to get out of the house, get into the car, and go somewhere social when all of that felt really overwhelming and chaotic and stressful. So they did it with her so that they were able to help her navigate that and manage it and feel like gave her the confidence that she was able to take on that task. And then if we're looking at co-occupations, so these are going to be occupations that are occupations of the infant, but they're also occupations of the mother. So it's happening simultaneously. So breast or bottle feeding, either way, whichever way you're feeding, it's an act that the mom has to do that has become a daily part of her life now. It's happening somewhere between 8 and 12 times a day. And then the baby also is learning how to feed. So looking at that, looking at both rest and sleep of mom and baby, toileting for both mom and baby, and teaching, this is where we can teach parents how to maximize diaper changes or ease of diaper changes, all those little hacks that are out there of how to not get peed on or not get pooped on. Like that's something we can work on and teach. Bathing your baby. So again, what are some of those tips and tricks that make this easier, make this less stressful? I've worked with clients before who haven't bathed their baby for a long time because they're terrified of the bath. And so this is something that, again, we can work on. This is now an occupation of the mom. She has to bathe her baby, but also baby has to get washed. So how can we make it better and more comfortable for both parties? Dressing, play. I mean, play is crucial for infant development, them achieving their developmental milestones, but infants can't play alone. I mean, they can entertain themselves for short bits of time, but they need somebody to interact with them and engage them. And also, the more we can educate parents on what they can do, we can then empower them to feel confident in the ways they can play and engage with their baby. And then helping with that social engagement and participation of the baby, looking and teaching parents about state control, so infant state, and whether they're agitated or calm and quiet, what we can do to help them find that little happy medium, and then what we can do to help teach on self-regulation. And this is a tricky phrase here because I'm not saying that babies should be able to self-regulate on their own. They need to co-regulate with you, but we have to teach them that. We have to help calm ourselves down so that then the baby can calm down as well. So this last section here, we're just going to dive into all of the ways that maternal health OTs can be involved in either various practice settings or work in conjunction with these providers, creating like relationships with these providers so that they can refer to you. So one practice setting is a pediatric dentist or an ENT. So there's a lot of information out there currently on tongue ties, lip ties, buccal ties, lots of information to sift through. And one way that an OT can be involved in providing both maternal and infant health is working in that pediatric dentist's office or creating this relationship with them for the referrals. Because if you're going to be doing any kind of laser or clipping, we need to also be working on the body of the baby and the ergonomics of either breastfeeding or bottle feeding. And that needs to be happening prior to the revision and then also post-revision. So this is a really great environment that OTs can work in to provide parent education, emotional support, educate on oral motor exercises to work on strengthening tongue and mouth, pre-revision and post, teaching and educating on scar and wound management, educating on tummy time method, which is, there's an OT out there that created this specific method on how to do tummy time in a fun and successful way so that babies aren't just placed on their bellies screaming for 5 to 10 minutes. And then really educating parents and teaching them on symmetrical development and how to notice if maybe the baby is starting to get a little bit of a head tilt or a little bit of a curve to their body, and how to notice it sooner so that it's not missed at your 2-month or 4-month appointment, because that's a massive gap in between when you see your pediatrician. So this is just a great place to collaborate and work with a provider. The next provider would be a pediatrician. And Jessica, I'll talk on this, but if you want to jump in at all and kind of share a little bit about what you're doing, I'll let Jessica share if she's interested, but she and her co-owner are actually getting nestled into a primary care office with a pediatrician to help, like, on the ground, frontline, being there to make a big difference. So, you know, we can work in a pediatrician's office or just have a collaborative relationship with them to work on infant development, teaching families early on. Like, you know, they bring up these issues to their pediatrician that they only have 15 minutes with. Well, let's get an OT in there that can start educating sooner and faster and resolve or prevent issues. So looking at infant sleep, feeding, transitioning to solids at, you know, 4 to 6 months, you know, depending on your baby, and educating on play, physical development, helping parents to identify if they're seeing a delay in achievement of milestones, or if they have no clue what they should be looking for in milestones. This is something that OTs can work on very preventatively with families. Educating on that gross motor, that fine motor coordination, reflexes, and that sensory processing and regulation, and what that looks like.
Yeah, and I can pop in and share a little bit. So basically, my business partner and I have integrated ourselves into a pediatrician's office, which actually allows us to see the families during their scheduled well checks for the first 3 months of life, because there's so much that comes up in that visit. Either the parents have questions or concerns about their baby, or the pediatrician might have questions or concerns that the parents are just processing in that appointment. And like Hayley said, there's time that passes in between. So what we actually do as occupational therapists in that setting is we essentially give the parents extra time to process. We provide more education on what the pediatrician has just said, or if they have specific questions or concerns related to their baby or themselves, especially the maternal health piece. And then we teach just basic strategies on how to bottle feed in a way that might be more comfortable for the parent or more effective for the baby, how to positions, how to play with your baby, things like that. And then lastly, we provide resources, which is really big for these families, because in primary care, we don't have enough time with our healthcare provider to get those things, though we really, really need it. And so we're, it's an emerging kind of practice area too, or a partnership for occupational therapists.
Ladies, I am over here. I have to stop because it's so much. I don't know if you can see my facial expressions. I'm over here like my leg is tapping. I'm over here trying to hold it together. I got about chats. I'm like, these ladies are amazing. Two people. And so I, you know, since it's just us, a small gathering, obviously is being recorded, I just can't hold it in. So I have to just give you like a midway hand clap, and just get it out, because I was just in an interview the other day, and the lady asked me, she said, Tasha, what do you feel about OT? She was like, what do you feel about OT? And I said, it's hard to really say passion, right? Because that's a very super passion. Like, I love what I do, right? But it's something about my belief, and I can't find the word, in this profession, or I feel like we are just not really recognized for the enormous amount of information that, I mean, we are, and I'm not biased. We're great. And so when you're talking about being in a pediatrician's office, Jessica, I have a classmate who's working on this for her capstone, but I've been preaching this like every day. I love, Hayley, how you took that scope of practice and a framework. And it's like, listen, I'm not making this stuff up, right? We didn't just come to the table and say, oh, we can fit this in. This is who we are. I did a 6-hour CEU course on mental health and acute stroke patients, and I just highlighted it. So I'm sorry, but I'm over here like, yes, I am just, mental health, maternal health isn't my passion, isn't my focus. But when I'm telling you, we can sit in every room, ladies. And you all are just an example of one area, being a mom, 2 kids, beef, all of these things. Is like, we're great. So sorry, I was trying to hold it in, but I'm just over here singing your praises, texting people like, this is great. So sorry, I'm a little probably ADHD myself, but I can't wait to talk to you all after. So I know this is being recorded, but I needed to just get it out because I'm like, yes, yes, yes. So, okay, back to mute, back to mute. Okay.
That's the best feedback and encouragement ever. Thank you,
It
Tasha.
really is. It really is. So thank you for sharing. Absolutely. Okay, so another practice area that we can be involved in is, again, either the collaborative relationship with sharing referrals and whatnot, or actually being nestled in their office. So with OBGYNs or midwives. So my practice is nestled inside of a midwifery practice, which is awesome because on the days that I'm there, if I don't have clients, but if they have somebody that they're seeing and they're like, can you just come in and just watch, see what you see, and then I'm able to on the spot provide recommendations or resources to the midwives that they can pass on to their clients. Or I've had clients come to me who are pregnant or dealing with certain issues that it's very much out of my scope, but I'm able to say, how about you go up front and make an appointment with the midwives because they can help with that a little bit better. So it's this beautiful collaboration, and the clients there just feel like they're actually being seen and heard for what is going on instead of 15 minutes of nothingness, which can happen. Unfortunately, primary care is just not
client-centered.
Yeah, it's not client-centered. It's insurance-based, which limits and dictates how much time you actually can have with your provider, which is so sad, so sad. So just looking at, and we've kind of talked about this stuff in looking at the occupations, but just a little bit more specifically looking at interventions. So during pregnancy, OTs can help. We talked about this, labor and delivery preparation, pelvic floor therapy. So if you have additional training and certification, then you can work on this, like pelvic floor therapy, scar management, strengthening, pelvic floor strengthening, all of that can start being addressed even in pregnancy. The literature has shown that the stronger you are during pregnancy and going into labor and delivery, the better your recovery is postpartum. And this is a tricky thing because if you are pregnant and you Google what exercises are safe during pregnancy, half of Google tells you everything is safe, and the other half of Google tells you nothing is safe. So this is where an OT can help you figure out what's safe for you and your body and where you're at. And then carpal tunnel is a very common symptom that women experience during pregnancy. And that is right up our alley as OTs and working with the hands and the forearms. So this is another area just, during pregnancy. And it's all these little symptoms that you start experiencing during pregnancy that either you or your provider start writing off as that's normal, happens to everyone when you're pregnant, it'll resolve when you're done. But that's not helping in the moment. And we as women, we need more attention and focus in the present moment to really help us navigate these times with more confidence and ease. And then looking at postpartum. So again, if you have that additional training, you can be doing postpartum pelvic floor therapy. You can be working on scar recovery after if they've had a tear or an episiotomy or a C-section, helping women get back to that exercise, that physical activity. And this is a huge one, supporting that role transition to motherhood. Once you go into birth and you have this baby, there is a loss of your previous identity and this shift into your new identity as a mother. And how to navigate that and manage that without feeling like you've lost who you once were. How can we bring some of that forward into this new space? And as OTs, I mean, that's just, we're great at that. We're really great at that. And then we talked about this previously, but providing support, education, and assistance with breast and bottle feeding. And then this one here, lactation support, I'm going to talk on it because I work on this too, but Jessica, again, if you have anything you want to add to this. So we talked earlier about the fact that breastfeeding is a co-occupation, or bottle feeding is a co-occupation. It's requiring both mom and baby for it to be successful. And so things we need to look at or work on are oral motor skills and coordination. So myself, I do lactation informed therapy. So I'm not a lactation consultant or an IBCLC. That's down the road for me. I hope it's in my future. But I've done a lot of courses in education to know the anatomy and the structures. So I can help with latching, strengthening, positioning, all stuff that overlaps with our OT profession. But as soon as stuff gets into really more of that lactation management and like supply and pumping and frequency of feeds, there's a lot of that I refer out to. So I'll work closely with an IBCLC to make sure we're not missing anything. But other pieces as OTs that's very nestled in our education and even without additional training, identifying that infant state of regulation, and then their sensory motor skills and their organization during feeding. You know, do you just have a crying baby you're always trying to bring to the breast? And what can we do? How can we teach you how to calm and soothe your baby and calm and soothe yourself so you can be co-regulated with the baby and then bring them to the breast or the bottle?
Hayley, I just want to speak on that when you said that, and I love, because I'm all about mental health, and I think that as OTs, we in our history, I've been practicing for 14 years. There's been a lot of separation between physical disabilities, you know, things that you all are speaking on, and then psych. And so I'm really loving the integration of mental health, and that's kind of what I love, and that's why my OTD has a concentration of mental health. But I do remember being a mom and, you know, having a really great experience the first time where my son latched, and, you know, I nursed, and the supply in the second birth wasn't like that, and going to a lactation, but also the mental health component of it where I just felt like a failure. Or when you talk about the regulation, I was so anxious and overwhelmed because he wasn't latching, and how that impacted both of us regulating during that ADL task, that IADL task, or ADL, I guess, because you could say feeding. So it's a really good point that you bring, because it's a component that I don't think a lot of people going to a lactation specialist and the nurse practitioner, I don't think they even thought about my mental health or how I was regulated when it came to doing the task. It was like, oh, he's okay. A lot of just very much like, literally, she said to me at the end was, well, he's fine. If he was on a stranded island, he would eat. And I was just like, that's the support. So I felt defeated. And I think that a lot of that defeat really impacted how I felt bringing him to the breast, how he was regulated with me being very tensed. And I think it impacted my supply, and it impacted, and I'm sure, Jessica, you can speak to that because you're getting that specialty, but just hearing you all talk about that, it's a component that I don't think people consider when they talk about breastfeeding, because it's so different for every child.
Oh, it is so different. And Latasha, you bring up a good point too, because I think it's so easy for, you know, nurse practitioner, an OBGYN or a pediatrician to just say, oh, it's not working. Well, here's formula. Just take this formula and that'll work. And how dismissive that is of your own goals and your own journey.
You said it, your goals and your journey. And we understand as OTs, when you have this journey, before we just say no big deal, like how do we modify? How do we adapt? Like what else can we do? Maybe he's not taking it. Do you? And so, okay, y'all, I'm holding it in, but it's just, okay, I'm sorry.
Yeah, I also want to respond to that because there is like the part where like, oh, it's not working. Here's just an alternative that's great for baby's weight. But there's also the situation where they're like, it's working great. The baby's latching great, and the mom is like, okay, how am I going to reproduce this at home? This hurts. Also, this is bringing back trauma. I like worked so hard to get here. I mean, Latasha, I don't know how old your children are now, but I can hear from your story that it brings up so many memories and so many emotions of how trying and meaningful that time was for you. And feeding a baby is like the first co-occupation that moms have to get like right out of the gate. We have zero support. We have zero models. We don't have our village anymore. We don't have our multi-generational household where we watch it and then we're expected to do it. I tell my parents, it's like somebody just gives you a motorcycle and says, okay, ride that to the next town tomorrow. Like, no, this is not safe for me. I don't feel like I actually know what I'm doing. I don't know how I feel on a motorcycle. Like, how am I going to balance myself? This feels awkward. You have to learn it like any other skill. But then there's this other component where you just gave birth to this tiny human, and all of a sudden you're responsible, single-handedly responsible sometimes for making sure that baby grows and thrives, and then it's put back on you. So it's just so complex, and we need more than, I love that we have lactation consultants. They are amazing. We really, really very much need that, but we need a multidisciplinary team, and we need peer support for this co-occupation.
Because my question would be too, because I had someone who came to me and it was the opposite. Where, ladies, do you find that? And I had an experience with someone who was dealing with the mental health component, anxiety, who on the flip side said, I can't nurse anymore. And so how does that look for you, Jessica? Because I know you talked about I feel like I read that in your bio. How does that look from an OT perspective? Like, okay, now I'm going to be weaning down, how that occupation looks, because I'm overwhelmed with all of the other tasks as being a mom, right? My own ADLs, right? And then the ADLs of caring for this baby, right? And then the co-ADLs that we're doing. And so how does that look from a standpoint of, you have a mom, nursing is going fine, but now they want to kind of be able to wean, and then that mental health of, I feel bad, right? Because society says that I should be doing this. This is the best thing. Have you had a client where you kind of work through kind of like the reversal of that?
Yeah, absolutely. And, I always like to tell people the first rule of lactation is, feed the baby somehow. And the second rule of lactation, if you want to breastfeed, is that we have to protect the supply. And the third rule is that everyone needs to be happy and healthy. And so there are many different things that we need to weigh. And the mother's mental health and how she's able to do the task is huge and foremost. Nobody else is going to breastfeed that baby for her. And so if she is struggling with mental health, and she's struggling with the idea of what are people going to expect of me if I stop breastfeeding my baby, since I've gotten this message that I need to do it. It's really, really hard. So really the very first thing that we do is just have a conversation about what that looks like for her. I mean, this is the mental health piece. What actually is that functionally going to look like for her? What is the plan going to be like? And then also, how does that feel for her? How does she want to process that? Because that is a grieving process. It's grieving something that we had expectations for, and now I have to take care of me so I can take care of my baby. But it looks different than I thought that it would. It looks different than people expect it to look. And so there's just, so many components.
I like that you call it the grieving process. I feel like the spot on terminology. For me, it was the opposite way, but great. I'm gonna try my best not to keep interrupting. Like,
Well, I think too, Jessica, like everything that you're saying is that like one of the biggest things that we have as OTs is the ability to look at the entire picture. Like we're not just so isolated in looking at like breast and mouth and that's it. Like we're looking at how it impacts everything, head to toe, mom, baby, both parties. Yeah. All right. So I think is this our last slide, Jessica? I think it is. Or close to it.
Sorry, I was muted. This is the last slide before we give resources because that's what we do.
So just a few takeaways about this presentation and what it means for you and as an OT, or if you're a different discipline joining us for this. Maternal health OT can be an integral part of improving health and well-being of moms and babies. And, you know, we can take a preventative method, we can jump in right in the middle, or we can join you at the end of your journey and process, whatever that is, but we have the capacity to improve well-being of both mom and babies. OTs have a unique capacity for understanding physical, mental, emotional changes during pregnancy, postpartum, motherhood, and how all of that impacts that role transformation. It's not just one aspect of those journeys that impacts how you feel about your motherhood, like your new motherhood profession. It's all of it combined. And then lastly, just providing support throughout the continuum of motherhood can support optimal infant development and maternal well-being. And kind of jumping in on getting in on the ground running, you know, when mom is pregnant, we can intervene in such a way that ultimately it's impacting long-term infant development. All right, so these are just some resources that Jessica and I are both very familiar with. The top one there, if you're looking under the Facebook groups, Maternal Health OT, that is the Facebook group for the group that Jessica, myself, and 2 other OTs have founded, all about maternal health OT. And then if you look in the bottom right-hand corner, maternalhealthot.org, that is the network that we have created. That's our website, but through there you can learn more about the Facebook community, but also this network that we've created because we all kind of came together out of this camaraderie, almost this shared experience that we didn't have resources as we were navigating the space and trying to get our businesses up and running, and our motherhood journeys up and running. And so this is a space that helps as students, as OT practitioners. We provide lots of resources, business resources, mentorship, all sorts of things. You can find that all in the network. That's a little picture of all 4 of us.
There we are. We have actually never met in person. And so that's another testament to how amazing the internet is, brings people together so that we can do amazing things. So I assume that we have some time to do questions. I don't know if there are any that are in the chat already or if people can unmute and ask.
Yeah, let me see what questions we have.
while she's looking, I have a question, ladies. Are there any? So one thing that I found was really useful for me, and it was a new model that I hadn't been familiar with, was the Kawa model. I'm not sure if you know. Are there any particular or specific OT models that you incorporate during the evaluation phase or the evaluation of your patients or the discharge when you're discharging patients? Are there any certain evaluations that are really OT based or founded that you use?
Well, I'm so happy that you asked. because the answer is that yes, there are certain models like OT models that we use, but none of them really speak to the big picture of what we do in maternal health. And so we are actually developing, the four of us are developing a model for the mother and infant dyad. But essentially, it sort of combines a few different models that we generally use. So like the PEO, the person, environment, occupation model, where, you know, anytime we are looking at a client or a dyad, we're looking at, you know, the whole person and all of the occupations or co-occupations that they need, and then also the environment or context that they need to do it in. But we're doing that squared because we have two clients, and then we have the dyad in the middle. And then in addition to that, because it's a family, there's also an ecosystem that surrounds them. So if you're familiar with the ecological model, which kind of looks at sort of like the micro environment, like, you know, what's going on in the home, in the family, and then a little bit outside of that, like what's happening in the community for those people or that family, what's happening, you know, politically and socially outside of that. And so that's kind of combined in our model. Those are, I think, the two that I personally like to use, and then kind of those are some of the components of the model that we're building. I'll also let Hayley answer.
Yeah, I mean, I echo everything that you've said, Jessica. And I think that what I found was that no one model was super comprehensive in what I was trying to address and work on. So it's been, you know, just pulling little bits and pieces from all that we've learned over the years to try to make sense of it. But a lot of what I do, because I haven't found like one specific model or assessment that really works for me, is that a lot of everything is very informal and just like a ton of information gathering. And then I'll help to like put the pieces together. So it'll be great to have something a little bit more like formal out there.
That's what I found with the Kawa model. I just love the visual representation of what it kind of encompasses, kind of the client being able to look to see kind of how they view their life, right? And the obstacles and the supports. My other question was, so with being OTs, and obviously, you know, we know within our scope of practice that everything that you all are doing is well within the scope of our practice, right? We understand that the foundations of mental health and psychiatric care came from where we are. And then the maternal, I love that you talked about from the mobility standpoint of how your center of mass gravity changes when you have the belly and things like that. How did you find, what obstacles did you have when it came to kind of having these partners such as OBGYN or pediatrician offices? What challenges did you have, right? And kind of what was your approach? Because I find that, you know, even working in a hospital setting, and I'm just being frank because we have this kind of opportunity, it's really hard when professionals or, you know, when they ask for you to see their patients to get their respect. So I'm curious about what those challenges were for you to say, hey, I belong here. Clients benefit. I just want to hear a little bit about that. I mean, we got time, so I'm just picking your brains now.
Yeah, so for me, I actually started in the midwifery office as a doula. So I was a labor and delivery doula. And it was through that I was able to really, you know, over the years, kind of like plant the seeds about what OT is and what we can do.
Okay.
I think one of the biggest challenges I faced in the beginning was believing and knowing in what I had to offer. Because if you don't believe and know in it, you can't then convey it to someone else.
Okay.
And since there weren't a lot of other people yet in this space, there wasn't a lot of guidance on like, what is maternal health OT? It's this like very abstract thing. So that was a huge hurdle for me, was kind of figuring out for myself, what is maternal health OT and how can I then present it to others? Midwives have always been really on board. You know, they already come from a pretty holistic standpoint, so they're really interested in any other additional holistic practices that you can add in. But I've had a lot of OBGYNs in the area, specifically kind of, I don't want to say bulk at, but like kind of say like, oh, you probably don't really need that. You know, like they don't yet understand the value of what we can provide.
You ladies are doing great work. I know you may have the answer too, but there's so much value in what we do, and what you ladies are doing now is really showing that, and being able to see how you all evolve with your own framework, your own assessments, getting that raw data, is what we need to really take our profession to the next level. From a motivational part, I feel like we've kind of been in the background a lot when it comes to physical therapy, and trying to fight really about, okay, well, what's this versus this? But I feel like we stand in a league of our own. We are so dynamic, and we are so under represented. We are so underutilized, and this is just it. I'm sorry, Jessica. I'm so excited, but I don't know if you had. I wanted to hear kind of how your thing would be with the pediatrician's office.
Yeah, sure. I mean, it was sort of you know, similar-ish to Haley's in that you know, we were kind of in the right place at the right time.
Mhm.
We had tried to just do basic networking with a lot of different providers, and you know, you could see some people get really excited about it because they've been a mom before, they had struggles of their own, they can see the benefit, but they can't quite see how it applies to their practice setting or referrals. So that has to be spelled out to them. And then there's people who like their eyes just glaze over, like they don't have a clue what we are talking about or what OT is, and they're like, I thought OTs worked with like, you know, hands, or like in hospitals with like people that had strokes. Like, you know, I don't know what you're talking about. But the pediatrician office that we have partnered with actually was already trying to think outside of the box. So they had actually done all of this marketing polls to understand what their patient population actually wanted from their healthcare providers. And what they found from that research was that they really wanted support in maternal health and in the newborn phase. And so we had happened to connect with one of the owners of this office, and he was just like, hey, I want to meet the needs of our families.
Wow.
And you happen to have the skills that they are wanting. Like, you know, let's talk. And it's just evolved. I mean, we just started this summer, and we are still working out the kinks and figuring out how we as occupational therapists, who really require a good like hour and a half to do a really comprehensive evaluation for occupational therapy, can integrate into the system where the providers see the families for 10 to 15 minutes max, and they're just shoved in there. I mean, there are 15 plus providers, primary care providers in this office, and they have tens of thousands of patients who are coming in and out. And, you know, they wanted us to do our services in 10 minutes. And so we had to get really creative.
So I know we're at 8:30. I'd like to connect with you both. I feel like I have some ideas. That's how my mind runs. I have a good friend of mine who's a mental health therapist, but she also works with CPS. And I feel like based on some of the stories that we have, I just have some really good recommendations that I think would benefit your model and a population of things that maybe you have or have not. So I'd like to email you all personally on my own. And then Jessica, I really like to get you with one of my classmates who's actually producing research on exactly what you're doing. That is her project, is to see the benefits. So she's actually getting data, and I think you all partnering would be great. It will provide you with some really good data for what you're already doing, but as you start to branch your business out, and I think it would support her as she starts to advocate for her own place. And so that's how my mind works, is like bringing things together. So hopefully it's okay. I plan to reach out from you all on my own, because I know we're at 8:30. I don't see any other things in the chat. I was highly educated, highly proud of you ladies, and excited about something that I was doing as a graduate assistant. But I think I came out of this with a lot more than I signed up for. So very grateful for your time, and just kudos to what you're doing. And so I'd like to connect with you all just on my own, if that's okay, because I got more questions.
Definitely.
Yeah, please do. And also, yeah, we need practitioners with boots on the ground and researchers. So thank you so much for bringing that up. And anyone who is listening, who is either a practitioner or researcher, like, the best partnership ever. Well, that's what we need, absolutely, to bring this forward. So thank you, everyone.
Thank you.
Yeah, I just wanted to also say thank you so much, Hayley and Jessica, for sharing your expertise. If anybody does have comments or questions, feel free to email the presenters or anybody on the slide here for, you know, with BayPath as well. This is just a page of how to get in contact with us. We are going to send everything out, the recording, in the next few days. So I just wanted to say thank you so much for joining our hot topic this evening, and we hope to see you at our future events. And I hope you all have a wonderful night.
You too. Bye-bye.
Hi, lady.